Welcome, Hannah and Dawn. Thank you for attending the short 30-minute training session on how to complete an adult pre-exercise screening system, or an APSS, what it's called in our industry today. Thank you so much for accepting the calendar invite and completing your learner needs analysis. That really helps me to adjust the training to your preferred learning styles, which you both prefer practical, kinesthetic styles, a lot of practical stuff, which is great because that's the type of session we're doing today. And also visual. Dawn, I noticed you take that. So we do have a video which can help retain the information that we're going to learn today. So welcome. And just before we go, continue on, I just need to do some safety and housekeeping. And point out the emergency exit, which is this door here, just behind you. And the emergency exit point is on the grassed area out the front of the building, down the back there. If you do need to use the toilet facilities, out the door to the right, into the main studio area. Water, if you need to fill up the water in the studio training office here. And if you can, please turn your mobile devices to silent unless you have an important call coming through, so we can stay on.
Just do that now.
Yep, no worries. That would be great. We'll give you guys a moment to do that. Cool. So today's learning objectives is to understand what an APSS is. Essentially, it's just a pre-exercise questionnaire that we used to do in the industry. They've just relabeled it now, which is good to note. So when you're referring to documentation, it's now called APSS. How to use the APSS to better understand the client's medical needs and exercise contraindications, which is really important. So we don't want to be making anything more aggressive or putting the client in a state where they could potentially hurt themselves. Then identify whether the client is cleared to exercise or requires further medical clearance. So the structure of today's sessions, I'll be going through the APSS with you. Then I'll show you a video on this demonstration on how to perform it. And then we're going to role play and do it together. So how's that sound?
Good. Sounds great.
Sounds good? Cool. All right. So I'm just going to ask you a couple of questions, being in the fitness industry already, but very new. When would you feel that you need to complete one of these APSS forms?
When you have a new client that you haven't met before.
Pretty much.
Yeah. And why do you think that's important? Why do you think that would be important?
So you know their contraindications. You're not going to hurt them. And they're not going to hurt themselves. And also to protect yourself legally.
That's a really good point.
And you can also design your program to suit the needs and their goals
of the client. Excellent.
Make sure you're not making injuries worse.
Excellent. And where do you think we normally would do something like this with a new personal training client?
In the gym or not in the gym, like in a safe spot.
Safe spot,
Maybe a little meeting room off to the side. Most gyms have like little areas that you can
room.
Like private, because it's a bit of medical history.
That's exactly right. There is some sensitive information, which leads me to a really good point and very important when you're doing an APSS is gaining consent from the new personal training client. So you're within your rights to refuse if they don't comply and give you consent, because then you can't actually give them an exercise program that's suitable for their needs. And you could be putting yourself and the new client at risk. So gain consent. Generally, most people are happy to do it, and they know it's something that needs to be done prior to exercising. So you shouldn't have too many issues, but if you do, there are some more training modules that are going to come out, so we can talk about how to get around those questions. So I'm going to just use an example here. I do have a printout for you ladies. So I'll give you a copy of this each so that you can look at this while we are going through it. It looks like a lot here. This is the standard APSS that we use in the industry. It looks like a lot of information here, but essentially we're just going to be reading to the client the questions and they're going to be answering it to us.
Okay.
And stage 1, we'll be going through stage 1, which is compulsory. And if we have time, we will go through stage 2 as well. Generally, if there are not a lot of yes answers, then it's going to be a pretty straightforward process. If there are some no answers, then we may need to chat about those answers. Yeah. So the main thing is to make sure that the client's comfortable. Hopefully you've built a little bit of rapport with the client, just to know a little bit of background, maybe some history, if they've exercised before. Are they working? Are they a mum or a parent, etc.? And then, so after that, you thank the client for their time and reassure them that, what we've done today is very helpful in the exercise program that you're going to prescribe them in their first personal training session. Perfect. Which is probably what they just want to get into. So I'm going to do this with Dawn, is that okay if we do this together?
Yeah, sure.
I'll do a practice run and watching this and Hannah watching as well when we do it. And then, if that's okay with you ladies, you will do it together in a role play situation.
Okay.
But before we do that, I've got a quick video, YouTube video for you ladies to watch. So it should explain it a little clearer, other than me talking. And if you have any questions after the video, we can go through that before we tackle it.
Oh, hey, how's it going?
I'll just get rid of the advert here.
Well, I have a system.
Skip. It's a 6-minute video.
Okay.
Hi, I'm Naomi from the Academy of Fitness. I'm now going to show you how to do a pre-exercise screen using the adult pre-exercise screening tool. I'll be showing you stages 1 and 2 today. Prior to beginning any pre-exercise screen or any fitness appraisals, it's really important that you obtain something called informed consent from your client. Informed consent is not simply telling your client what it is you're about to do, but it's about giving them as much information as possible so that they can make an informed decision about whether or not they wish to participate. With your pre-exercise screen and your fitness appraisals, your client does not have to participate in anything that they are not comfortable with. This, however, may mean that you are not able to accurately obtain their risk stratification. If this is the case, you must inform your client of this, as you may not be able to write a program for them. They can then take that advice on board and choose as to whether they wish to participate or not. Okay, Dave, I'm about to take you through the adult pre-exercise screening tool. The purpose of doing this is to ask a series of questions to try and get as much medical information about you as possible. The reason that we do that is we need to try and identify what's called contraindications to exercise. And a contraindication is anything that, if present, can be potentially harmful to you while you're exercising. And it can be something as simple as a sore ankle through to something as serious as cardiovascular disease. I'll be asking questions in stage 1 here, and then we'll flick over and we'll go to stage 2. In identifying these contraindications, it helps me to determine what is an appropriate level of exercise for you to work at, so what intensity. It also then helps me to determine what exercises I should actually put into your program. One of the most important things, though, I can get by doing this pre-exercise screening is it tells me whether I need to refer you to get medical clearance by a doctor.
Yep.
Are you happy for me to go ahead with this?
Yeah, totally, it's fine.
Excellent. Okay, so this stage 1. The aim of the stage is to identify those individuals with a known disease or signs or symptoms of disease who may be at a high risk for an adverse event during physical activity or exercise. Now, normally this stage can be self-administered or self-evaluated, but because I'm here with you today, I'll take you through this.
Yeah.
Okay, the first question. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Fantastic. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Good. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Brilliant. If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Excellent. Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
And do you have any other medical condition or conditions that may make it dangerous for you to participate in physical activity or exercise?
No, not at all.
Fantastic. I'll get you to sign just down the bottom there for me, Dave. Okay, because you've answered no to all of these questions.
Sorry, just want to point out just one thing in the video. So they have updated the APSS. So a couple of those questions, I'm not sure if you noticed, have been removed from the updated version. So this has come directly from Oz Active. This is the most updated version. And they remove questions perhaps because it's outdated, or we just don't need to ask those questions anymore. So just keeping that in mind. This video was a year ago.
Okay.
We can now progress on to stage 2. So just turn over the page. Okay, so the aim of this stage is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by an appropriate exercise professional, which will be obviously me today. Okay, Dave, I just need to find out how old you are.
I'm 40.
Wonderful. So, because you are 40 and you're a male, that means that you do not have a risk factor for your age and gender, so that's fantastic. Have you got or do you have a family history of heart disease, such as stroke or heart attack?
Nothing like that.
Okay. Do you smoke?
Never in my life.
Wonderful. Okay, we need to have a look at your current physical activity levels.
Very easy comment.
Do you consider yourself sedentary, or do you participate in light, moderate or vigorous exercise?
Moderate.
Wonderful. And how many sessions per week?
5 times a week.
For how long?
60 minutes.
Excellent. So that's about 300 minutes, which means you have gone above the recommended guidelines of 150 minutes per week, which is fantastic. That gives you a -1 risk factor, so it's brilliant. Okay, your height and your weight. So your height was
175 centimetres.
175 and your weight?
90 kilo.
90 kilos. And we worked out earlier that that gave you a BMI of 29 kilos per metre squared, which keeps you underneath the risk factor there of greater than 30 kilos per metre squared, so that's wonderful.
Yeah.
Have you ever been told that you have high blood pressure?
No.
Great. Have you ever been told that you have high cholesterol?
No.
And have you ever been told that you have high blood sugar?
No.
Excellent. So on this page, you're actually at -1. That's good. Wonderful. Okay, a couple more questions. Have you spent time in hospital, including day admission, for any medical condition, illness, injury during the last 12 months?
No.
Brilliant. Are you currently taking a prescribed medication or medications for any medical conditions?
No.
Great. And I'm assuming that you're not pregnant or haven't given birth in the last 12 months. Fantastic. And do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
That is brilliant. Okay, so what we now need to just assess is what's called your risk stratification. And this, by what you've answered in the pre-exercise screen today, I'm able to ascertain that you are a low risk client. So you can either be low, moderate or high risk. So you have a total of -1, which makes you a low risk client. So individuals at low risk may participate in aerobic physical activity or exercise up to a vigorous or high intensity. And if we have a look at this table over here, here is our vigorous and high intensity. So you are able to exercise up to a level of 90% or greater of your heart rate max, which in terms of your RPE or your rate of perceived exertion, that's greater than 7. The other wonderful point is that we don't need to refer you for medical clearance, so you're able to undertake an exercise program today. Cool. Wonderful. Thanks, Dave.
Okay, how do you feel?
Yeah, pretty straightforward, but he was an easy client.
He was very easy, wasn't he?
Yeah.
And for today's demonstration purposes, if you do want to list down if you do have any of these medical conditions, you can. Being mindful of the time, it's only a 30-minute session here today.
Yeah.
So we're going to try and.
Is that about how long you would normally allow for?
If you were
an
doing
APSS?
one-on-one, because today's a bit of a group session, we need to be mindful that we're trying to get everyone trained in this, and we will schedule another training session on how to calculate BMI and things like that that are in this form.
Perfect.
But today, for today's purposes, we will just go through completing this form.
Okay.
Yeah, if that's okay. So, because Honey, you like to do practical stuff and be mindful of the time.
Okay.
How about you and I do the first one? So
Sounds
you are the trainer.
Okay.
I am the client.
Yep.
I'll be good and easy for you.
Okay.
And just go through the first stage. We'll go through just stage 1 today because of time pending. So just this page is all you need to do. Yep.
Okay.
So at the end of stage 1 here, you will just be able to identify whether they need a medical clearance or they're absolutely fine to continue an exercise program.
Okay, cool.
Yeah.
Alright, so just fill your name up here.
Yeah.
And your date of birth?
5th of March.
Oh, soon.
Yes. 1981. You don't calculate my age.
And you're
I
female?
am female.
Male?
Yes.
Female. Okay,
I'm
yeah.
female.
Rightio. So this form is basically to just identify if there's any reasons or risk associated with doing a program for you. So it's going to work out if we have any diseases that could give you a higher risk or any adverse events that could be unexpected as a consequence of exercise. So basically we want to make sure that you're going to have a program and it's not going to harm you. This stage may be self-administered and self-evaluated, but for today, because I'm training, I'm going to do the form for you.
Yeah, thank you.
So I'll just get straight to question number 1. Has your medical practitioner ever told you that you have a heart condition or have ever suffered a stroke?
No.
Do you ever experience unexplained pains or discomfort in your chest at rest or during physical activity or exercise?
No.
Have you had an asthma? Yep. No. Do you ever feel faint, dizzy, or lose balance during physical activity or exercise?
No, unless I train really, really hard.
Okay, so we won't be doing that with you today. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes, type 1 or 2, have you had trouble controlling your blood sugar
No.
in the last 3 months?
No.
Do you have any other conditions that may require special consideration for you to exercise?
No, I don't think so.
No. You're just healthy, which is good.
Yeah.
Describe your current physical activity exercise levels in a typical week by stating the frequency and duration at the different intensities. For intensity guides, I will tell you. So for light intensity, how many sessions you do per week?
Oh, maybe 2. I'd say 2. Yeah.
Okay, and then we'll bump it up to moderate. How many do you
I'd probably 2. Yeah.
2, and then high or vigorous.
I wouldn't
0.
Yeah.
When you like to cruise.
Yeah, I like to cruise. Yeah.
And roughly for the light, how many minutes per week would you do in those 2
Probably
sessions?
not 40 because it's generally a walk.
Okay, so
Yeah.
20 minutes per walk.
Yeah. Yes.
And moderate?
They're 30 minutes each.
Okay, so
that's
60
yeah.
and 0 for vigorous.
Yes. Yeah.
Alright, so that's pretty much 100 minutes. So you are definitely light to moderate intensity for your recommendation.
Yes.
And you can increase your volume slowly.
I can, yes.
So that's good. So we're just going to keep tabs on your volume and intensity, and if you want to increase it, then maybe we'll be a joint discussion and then we can see what we can do. I'm going to get you to sign at the bottom here if you're comfortable with that.
Yeah. Thank you.
And the date is the 2nd of March. That's great.
Perfect.
Thank you.
Excellent.
Alright, so there's a little bit more to do.
Yeah, that was really good. How did you feel? about that?
Yeah, good.
It's
It's
like-
easy.
yeah,
The form
it's easy.
guides you.
It really
well
does, doesn't
designed.
it? Yeah, yeah.
Like I said, if people are saying yeah to all of this, it's like
It's gonna be it. Yeah. It puts everyone at a little bit more of a risk.
Yes.
Yeah. So generally, we can just get medical clearances for these clients to
Yeah.
exercise safely. Yeah.
At what stage do you need exercise clearance?
So this form in general says if you've answered yes to any of those questions, it's
Okay.
advised. So it's that we're obligated to advise them to seek medical clearance to exercise with us. Particularly so with our type of training, F45 training, it's high intensity. So it's probably really important if they have answered yes to these.
Yeah.
So when we do stage 2, which goes into a little bit more detail, there's a fair bit more to go through.
Okay.
That will help you identify whether or not the risk factor is really high and medical clearance is required to protect yourself and the client.
Yeah.
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 Okay.
As you know, you guys all have your own personal insurance. However, it's our clients are number one priority. They want to keep them as safe as possible.
Yeah.
Yeah.
not good for
that makes-
business anyway.
Absolutely not good for business, no. And when you have new clients, their intensity is going to start a lot lower anyway,
Yeah.
and then we build them up. Yeah, yeah. Because this type of training is not your regular type of training you would do. So, any other questions about it? You did really well. You did really well without having to
Yeah.
ask any other questions. And yeah, this form is really easy. So, knowing that you guys are still new
Yeah.
to personal training, it's pretty much done for you. You can
Yeah,
feel
it's easy to
comfortable with your
follow.
new client to follow.
Yeah.
Yeah, brilliant. So, if that's okay, we're going to go, Dawn, you're going
Okay.
to now perform the stage 1.
Stage 1. So
Yeah,
just what
APSS.
Hannah's done.
With
but
Hannah,
with
yeah.
Hannah.
So Hannah's your new client. You're the trainer, and you're going to do her APSS
Awesome.
with her. Yeah.
Hi,
Yep.
Hannah.
Hello.
How are you feeling today?
I'm nervous about exercise.
You look like you've exercised in the past. So what we're going to be doing today is completing an adult pre-exercise screening. So that just gives us some indication on whether you're a low, moderate or a high risk when you exercise. So there's going to be some questions that I'm going to ask you. If you don't feel comfortable, please let me know.
Okay.
Yeah, it's important that I get your consent to get these questions. It's important that I ask these questions so then I know what your risk factor is as well, and if you have any conditions that might be a little bit we need to know about, we'll get medical clearance.
Okay.
Are you happy to proceed?
Yes.
Okay, so your full name is
Is Hannah?
double N?
Yep.
A-H? And then
Long D.
long D, yep. And your date of birth?
28th of May, 1987.
Female. Okay. Okay, so there's 6 questions. The first one, has your medical practitioner ever told you that you have a heart condition or you have ever suffered a stroke?
No.
Do you ever experience unexplained pains or discomfort in your chest at rest or during physical exercise?
No.
Easy. Do you ever feel faint, dizzy or lose balance during physical exercise or activity?
No.
Have you had an asthma attack requiring medical attention at any time over the last 12 months?
No.
If you have diabetes type 1 or 2, have you had trouble controlling your blood sugar or glucose in the last 3 months?
No.
And do you have any other conditions that may require special consideration for you to exercise?
No.
No. Okay, so that was pretty straightforward. It looks like you're pretty low risk. I'm just now going to proceed to the next section, and it just gives me an indication of what you're already doing as exercise.
Yeah.
So we've got 3 different intensities: light, moderate, or vigorous, or high. Do you do any light exercise in the week?
Yeah, probably one session.
1 session. And how many minutes or duration would that be for the
Like
light?
25 minutes.
25 minutes. And any moderate?
Yes.
How many sessions do you
Probably
do?
3
3
sessions.
sessions. And how many minutes?
Probably 3 sessions. Oh, how many minutes?
Minutes are each session?
Probably 45, 90 minutes.
So 90 minutes per session or 90 minutes?
Oh no, 3 times 45, what is that?
90, 135?
Yep.
135 minutes. And you're vigorous or high?
Probably 3 sessions.
So then 135 again. So that's quite a bit of time. So what we've got 270, 295. So your total is 295 minutes per week. So that means that you can continue with your current physical exercise at your high level.
Very physical.
That's very physical. You're very active.
Yeah.
And now I just need to get your signature if that's okay.
Yeah.
Yep. So just there at the bottom, and the date, which is the 2nd of March.
There you go.
Great. Thank you.
Perfect. How did you feel doing that?
Yeah,
You seem
good.
pretty
I got a
confident.
little bit stuck with explaining at the
Yeah.
start. I got a little bit tongue-tied.
Yeah.
Possibly better if I just read a little bit of what the form is, so I
Yeah,
don't go
yeah.
off course. But
Yeah. Yeah, but it's all there for you, and the more you do it,
Yeah.
the more it's just going to roll off your tongue. And yeah, I noticed that you had already explained all of this previous to starting the questions,
Previous
which
to
is really good. It
Yeah.
doesn't matter how you do it, as long as
Okay,
you,
as long as it's
as
covered.
long as you inform the client that that's what's going to happen and why we're doing it and the importance of doing it, and then going into those questions.
Okay.
So you can see how it can get a little bit personal too. with
Yeah.
the client and customer. So yeah, and really good to note that you asked for consent.
Yeah.
Yeah,
That was
I
really
will do
good.
that.
Yeah.
So we were onto it.
Yeah, and really good that you noticed that. Hannah. So
Definitely
yeah, so those kind of things.
So if they don't give consent, then at that stage, what would you do?
Yeah, so this is we will be handling objections in the next training
Okay.
session. But essentially, yeah, we need to talk through that with the clients.
Okay.
To
I think you did say at the start of this session.
yeah, yeah. No, just to
maybe
touch on
not
it,
able
I'm
to see.
mindful of time. But
Yeah.
yeah, just to touch on it, we would ask another series of questions.
Okay.
To show them the importance of why we do this. And it could just be a medical approval that they supply us with, and then we
Okay.
can go ahead with the exercise program. Yeah.
Okay.
So here's a quick question,
Yeah.
because I know we've got
Yes.
no time.
Yeah.
But if you get someone that's really blasé, kind of like arrogantish, and they
Yes.
just want to get into exercise,
Yes.
and they're like, no, blah 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 blah, and they're not really giving you the time of day to really work out if they're being truthful or not, can you advise them to get medical?
If they,
anyway.
do you mean if they've ticked yes?
No, if they're just saying
Saying
no
that?
to everything, but you might see something
It's physically
in person, or
Mm.
you might just have a suspicion that they're not being honest with you, or they're
Mhm.
just being really blasé, they're just trying to get through it and not really taking it seriously.
Yeah, yeah. So a really good question. So within our scope of practice and our qualifications, we must adhere to the forms.
Mm-hmm.
So if they are saying that there is nothing there, then we take that as true,
Okay.
truthfully, and respect that.
Yeah.
And if they've signed that, then that's
on them.
it's their responsibility. Yeah. So as long as we are performing it, this is why it's really important to do
Yeah.
this. So it takes the responsibility away from us if anything was to happen later on. However, we do also do a training session on building rapport and gaining confidence with your personal training client, so they feel comfortable releasing that kind of information
Okay.
with you, because we want to try and get that, but they're not obliged to.
Yeah.
Yeah, it's a bit of a tricky
Yeah.
topic and a
Yeah.
sensitive one, so
Yeah.
that's
It
why
is
it puts us in a little bit of a tricky situation. So this form here is to protect
Yeah.
you and the client,
Yeah.
essentially. Yeah. So how would you feel, I guess, doing this with a new client?
Easy.
Yeah?
Yeah. Very
Confident?
straightforward. Yeah.
Yeah.
As long as
Yeah.
they said no to everything.
Yeah.
But then you're just getting the medical clearance.
That's right.
correct?
Yeah, which
Yeah.
we'll go through the next training session when we do that one.
Yeah.
Which you feel a little bit more comfortable in how to handle those objections
Yeah.
and what to do.
Yeah.
And the more you're in the industry and the more experience you have,
Yeah.
the more comfortable you'll be able to feel, and the more you can elicit those kind of things from a client.
Okay.
Yeah, to share that with you. Yeah. But I think today you ladies did really, really well. I'm very confident in doing an adult pre-screening system, which is awesome. Do you have any other questions before we wrap up? I'd really like to grab your feedback from today's short 30-minute training session, if that's okay. We've got a couple of minutes if you're able to complete that for me today. Otherwise, I can email it to
We
you.
can complete it.
Yeah.
Excellent. I'll just give you that one. And that one. Maybe just run your eyes over that and wait for the pen to be available. Apologies. So when you go home tonight, this is a form for you to keep.
Yeah.
I will send you through an email, a follow-up email with the pre-exercise screening form for you, so that you can print it off for your clients, your future training clients. And if you have any other questions that you think about after today's training, just send me an email. We can go over that.
Sounds good.
Yeah,
Thank you.
thank you.
That was good, thank you.
Yeah.
They're good
Yeah,
forms. like,
They are, yeah. And
Yeah.
they're quite involved, so
Yeah.
stage 2 takes a little bit more time to
Yeah.
get through.
So it gives you a little bit more history.
Yeah, it does, yeah. Which is helpful.
Yeah.
Knowing that, it's
This is good where it explains, so if they didn't understand the light, moderate, or
yeah.
go
This is
through
why
that.
it's so important to
Yeah.
have this form with them, and even giving them a copy of this so they know where
Yeah.
they sit in regards to light, moderate, vigorous, and high, and where the heart rate should be sitting as
Yeah.
well. Yeah.
There you go.
Yeah, excellent. Thank you so much. Thank you so much for
Thank
attending.
you.
Keep an
Thank
eye
you.
out for the next invite to the next training.
Perfect.
That'd be great.
Excellent.
Looking